Hey, welcome. Today, we are talking about something huge, a hidden health threat that is, without a doubt, the starting point for almost every single case of type 2 diabetes. It's a condition that millions of people live with for years, sometimes decades, and they have no idea. But here's the good news. The really good news, it's often reversible. So let me just ask you, what if you could stop type 2 diabetes in its tracks, like 10, maybe even 15 years before you'd ever get a diagnosis? I know, it sounds almost too good to be true. But that is the exact window of opportunity we're going to explore today. Because check this out. The science is really clear on this. A staggering 90 to 95% of all type 2 diabetes cases are caused by this one single underlying condition, insulin resistance. It's not just a small piece of the puzzle. For the vast majority of people, it is the puzzle. So, okay, let's get into it. Here's the game plan for today. We're going to pull back the curtain on this hidden threat. We'll look at what's actually happening inside your cells, when they just stop listening. We'll cover the silent signs to look out for, and then, and this is the most important part, we'll go over 7 powerful strategies to reverse it. Finally, we'll talk about tracking your progress and how you can be in the driver's seat. All right, Section 1, the hidden health threat. Now, the key thing to get here is that insulin resistance doesn't just show up one day. No, it's more like a slow burn. It quietly develops over 10 to 15 years. And you can look at that in 2 ways, right? It's a serious warning, for sure. But it's also this incredible window of opportunity to do something about it. Just look at how this plays out over time. Way back at year minus 15, your cells start getting a little stubborn, a little resistant. So for the next 5-10 years, your pancreas goes into overdrive, pumping out tons of extra insulin just to get the job done. Then, about 5 years before diagnosis, you hit the prediabetes window. And here's the kicker. By the time a doctor says you have diabetes, up to half of the function of your precious beta cells, those little insulin factories in your pancreas, could already be gone. That's why catching this early is everything.
Okay, on to Section 2. So what does it actually mean when we say your cells stop listening? Let's break this down with a really simple analogy that makes it all click.
So, the textbook definition is pretty straightforward. It's when your body's cells, especially in your muscles, fat, and liver, basically start to ignore the instructions from the hormone insulin. They become resistant to its message. So here's how things are supposed to work, and this key and lock idea makes it so easy to understand. You eat something, your blood sugar goes up. Your pancreas then releases insulin. That's the key. That key travels through your bloodstream to a cell, which is the lock. The key fits perfectly, unlocks the door, and boom. Glucose gets inside the cell to be used for energy. And just like that, your blood sugar goes back down to normal. It's a beautiful system. But with insulin resistance, the lock gets all rusty and jammed. The key is there. In fact, your pancreas is making extra keys, yelling, "Hey, open up!" But the cell just isn't listening. The door stays shut. And where does that leave all the glucose? It's just stuck floating around in your blood, causing all sorts of problems. So what's jamming up the lock in the first place? Well, the #1 cause by far is excess visceral fat. We're talking about that deep belly fat around your organs. But it's also things like not moving your body enough, a diet heavy on processed foods and sugar, chronic stress, and yeah, even just a few nights of bad sleep can start to gum up the works. Okay, let's move on to Section 3. Even though insulin resistance is often called silent, your body is definitely sending out clues. The real question is, are we paying attention? Let's look at some of the most common signs. That extra belly fat? A waistline over 40 inches for men or 35 for women is a huge one because high insulin is a fat storage hormone. See those little skin tags? Or maybe dark velvety patches on your neck? That's because high insulin also makes skin cells grow too fast. And how about that crazy energy crash an hour or 2 after eating? That's the blood sugar roller coaster. Or those intense, gotta-have-it cravings for carbs. That's your cells literally starving for fuel, sending out an SOS signal.
But as helpful as those physical clues are, the most important, undeniable evidence is hiding in your blood work. That's where you get the real, objective story of what's going on.
And this is where you can really take charge of your own health. You need to ask your doctor for these specific tests. A fasting insulin level is the most direct way to see what's happening. The HOMA-IR score is even better. It actually calculates your level of resistance. And then you have your HbA1c and a lipid panel, which can show those classic warning signs like high triglycerides and low good HDL cholesterol.
And now for my favorite part, Section 4. We've talked about the problem, now let's talk solutions. This is the hopeful part.
These are real, evidence-based steps you can take, starting today, to take back control. And if you ever doubt for a second how powerful you are in this equation, just look at this famous study. People who made lifestyle changes, we're talking diet and exercise, they cut their risk of developing diabetes by 58%. Now look at the medication. It only cut the risk by 31%. That means lifestyle changes were almost twice as effective. Your daily choices are the most powerful medicine you have, period. So here it is, your toolkit for turning things around. The single most impactful thing you can do, lose just 5 to 10% of your body weight. Then move your body. About 150 minutes a week is the goal. Upgrade what's on your plate, less processed junk, more real whole foods. And don't forget the foundations, good sleep and managing your stress. And finally, you can try time-restricted eating to just give your insulin a much-needed break. And listen, you don't have to tackle all of this at once. Just pick one. Start there. All right, section 5. So how do you know if all your effort is actually working? You have to track it. It's so true. You just can't manage what you don't measure. Seeing progress is the best motivation there is. And you can keep it simple. Every month, check in with your waist measurement and your weight. Then, maybe every 3 months or so, work with your doctor to get those labs rechecked. I'm telling you, there is nothing more motivating than seeing those fasting insulin and HOMA-IR numbers start to drop. And I get it. Trying to connect all those dots, what I ate, how I slept, how I moved, and how it affected my numbers, it can feel pretty overwhelming. That's honestly where tools like My Health Gear Wear can be a game changer. They help you see the direct link between your lifestyle choices and your glucose patterns, so you know exactly what's moving the needle for you. Which brings us right to our final section, and it's the most important message of all. You are in control. I really want that to sink in. Every small change you make compounds over time, and those small changes build into massive, life-changing results. I absolutely love this quote, because it just says it all, doesn't it? Your genetics might load the gun, maybe giving you a higher risk, but it's your lifestyle that actually pulls the trigger. And the most incredible, empowering part of that is that you have control over the trigger. So, I want to leave you with a simple question. Don't think about overhauling your entire life overnight. Just think about this week. What is the one small, totally doable change you're willing to start with? Maybe it's just taking a 10-minute walk after dinner, or swapping soda for water. Whatever it is, that's your starting line. That's where you begin to take back control. And of course, just a quick and important disclaimer, everything we've talked about today is for educational purposes. This is not medical advice. Please always consult with your own healthcare provider for any personal health concerns. Thank you so much for your time today.